Branca. What I'd like to share with you today is the most incredible ground floor business opportunity I've ever seen. To build a business driven by residual income. The market is potentially unlimited. Everyone can benefit from this product. You can help businesses and individuals by saving thousands for them in medical expenses. Best of all, this product is free at no cost at all to the end user. This is the only business opportunity I've ever been involved with that has no downside at all. Let's find out. This appeared recently in the U.S. Today. 1 in 6 U.S. residents, according to the U.S. Census Bureau, has no health coverage whatsoever. Now, with health insurance is the lowest since the government began keeping that data way back in the 1980s. On top of that, over 40 million employees with health insurance have adequate or no pharmacy benefits. The rise to almost 17% in uninsured were many. Obviously, the most glaring, employees losing their jobs in the recent recession. Companies dropping employee coverage just stay afloat and going without coverage just to cut costs. But the biggest driver behind the rise of the uninsured is the ever-escalating cost of medical care. Today, workers pay about 50% more than they did just in 2005 for family health coverage, while employer pays about 20% more. For those who have employer-provided insurance, many have deductibles that are higher today than ever before, which forces out-of-pocket payments for retail pharmacy pricing, tapping into their earnings and depleting savings before they can even take advantage of copays for medication. Well, we're living in an aging nation. We have over 40 million Americans today, 65 years and older, and the number will double in about 4 years. There'll be over 80 million Americans over the age of 65. We've seen it recently in the news with the budget cut talks. Security reform has put many retirees in a bad way by limiting Medicare and creating gaps in their coverage called donut holes. It's a gap in coverage whereby a senior has to pay retail pricing for medication. Look at the numbers again, just to review. 40 million seniors today and 80 million in just 40 years. Uninsured, approaching 51 million with no insurance at all. Under another 40 million with high deductibles or no prescription plan. Those prescription coverage have ever-escalating copays each year. It just keeps going up. And let's not forget the new folks to the country. 30 million immigrants, both legal and illegal, who will never have health insurance. This huge dilemma and this big problem. Well, let's start at the very beginning, the pharmaceutical industry. Its revenue produced over $300 billion last year, and that number will double in just 6 years. Medication will account for over 17% of total healthcare costs. Now, 17% doesn't sound like a very big number unless you look at the whole picture. You've got your office visits, city practices, surgery, acute care, hospitalization, rehabilitation. 17% just medication. That's a big number. Pharmaceuticals, obviously, a very profitable industry. To produce the average prescription is just pennies a pill, especially after FDA approval, marketing, and testing. Managers and pharmacies routinely mark up product well over 3,000%. That's a misprint, 3,000% plus. And on the other side, you have third-party administrators called pharmacy benefit managers who add to that cost up to $35 per prescription. Those who don't know, a PBM is a necessary entity that does plan management. When you take your prescription to a pharmacy, they go to the computer because the PBM in the background is telling them what to charge for a copay. Pharmacy benefit managers started out on the right road, but they've lost their way. Medco, Express Scripts, and Caremark, who control 90% of the insured market, are public-traded entities, and their own concern is shareholder value. They're actually disadvantaging the people that were brought in existence to help, consumers. Negotiate deep discounts through volume with managers and wholesalers, and they make the worst deal for the managers and pharmacies. They get people to the middle called the spread. They hold back rebates, refunds, and yield spread, as well as do pill swapping. Well, Cut, the founder, who's a pioneer in healthcare technology for over 28 years, discovered this billing practice of the PBMs and testified in front of a congressional subcommittee, but to no avail. So he decided to create his own cure. He created the first accredited PBA called the Pharmacy Benefit Administrator. Still, PBMs has that functionality in the background to do plan management, except, unlike the PBMs, RX operates with full closure. It is a 100% transparent pricing model in the industry, offering retail and mail order programs at the guaranteed lowest price. Every negotiated discount is passed through to the consumer. His to deliver affordable health care to every family within our borders. His approach to leverage knowledge of the industry along with efficiencies in technology and girth, traffic volume, to negotiate deep discounts and take the PBMs right out of the equation. And also a free prescription card accepted just about everywhere. This is a typical discount card front and back, accepted every major chain, as well as 98% of all independents. I've seen this not accepted. And the reason why these large chains would accept a discount card and cut their price is because they're interested in foot traffic, market share. When you go to CVS, where's that pharmacy located? It's in the store. You have to pass all the aisles and buy all the other product while you're getting your prescription. Benefits of the card is many. First and foremost, consumers can save up to and exceed 75% discounts off the price of every FDA-approved drug. No cost to the consumer. There's no pre-qualification. Pre-existing conditions don't matter. Everyone qualifies. The moment this product is frictionless, we collect no information from the consumer, including a name or email address. Everybody can use the card. No activation period. The card active at the moment is printed. Notables, no hassle. The consumer with our card is guaranteed the absolute lowest price, and the company provides a 24-hour customer service hotline as well. Well, the group's mentioned already. The uninsured, the uninsured, the seniors in the Medicare donut hole, and now, unlike any other discount card on the market, the 210 million insured Americans can benefit from this card as well. Back in November of last year, Free for All, the Equalizer program, card rides the same road tracks as the PBMs at the pharmacy levels, become a true secondary form of payment, guaranteeing the lowest price to the client, whether it's the copay, the discounted price, or the retail price. And the only time for all charges the pharmacy a $2.50 third-party fee is when the discounted price is the lowest option, which is the majority of the time. With this same card, there's laboratory tests. You can have to over 3,000 labs nationwide for any kind of diagnostic services. It's very affordable, as you'll see in a second, convenient. You choose the lab and location that's best for you and confidential, and that you decide who sees the results. Here are a couple of quick pricing examples. Retail compared to RX Cut, and obviously the discounts well exceed 50% off of retail. In addition, there's more benefits. You'll have access to free major centers across the U.S. for wellness, prevention, and early detection programs. A very simple procedure. Just call the toll-free concierge number. They'll set your appointment up for you. And once again, confidential, you get to say who sees the results. And the prices are as follows. More than 50% discounts off MRI, CAT scans, and PET scans as well. So other than the fact of satisfaction that you're helping everyone, well, how about consistent monthly income? The minimum order is 5,000 cards. Every time one of your cards that distributed is used, you'll earn a commission. So if you give 5,000 cards, and let's say only 2,000 are used once a month, you would earn over $1,000 per month of residual income forever. When people use this card and it works, they put it back in their wallet, and it never expires. The average person uses the card about 1.5 times a month. You can grow your organization, replicate yourself, and your commission grows. If you were to bring 5 distributors in under you, they had the same type distribution utilization numbers, you would have about $2,500 per month off your downline. One would make about $1,000 per month on their distributed cards. And you could take that to the next level, multiply that number. 10 distributors would net you about $5,000 in monthly residual income with no effort on anyone's part after distribution. What else? You'll receive a free immediate website with all the tools of the corporate site, where visitors to your site can print the cards that are coded with your unique group number. They can also use all the tools. Applications locate participating pharmacies online with our Google map. Search for manufacturers' coupons and have access to 24/7 bilingual customer service. And you'll have access to another website, your back-end partner portal. Review your transactions updated every day. Have the ability to print high-quality marketing and educational material, strategies for distribution along with sales aids. On top of that, you'll have ongoing support and training from corporate and leadership team. Your question, what's the cost to join? This is not an LM. It's a one-time setup fee of $50, which gets your website going. Monthly fee, $0. Profit sharing, nothing. Training fee is free. The website is a one-time $50 and no more recurring fees for that. And the only additional cost is $50, which you'll receive 5,000 heavy stock, full-color laminated cards that can be private labeled at no additional cost. How to sign up? Well, contact me, Al Branca, at 856-304-4874. Email any questions to able2@comcast.net for more information. The procedure is simple. You fill out 2 forms. I see you a link to enroll online and go to the secure pay site. Instant free website and access to a partner portal just like that. A very easy business model. I'm not sure what you do today. This could be a part-time thing that you just add to your portfolio mix or full-time. What's easier than giving something for free that can save people lots of money and getting paid for it forever? Or your cards immediately happens right after you come on board. I want to thank you for your time. We'd love to see you on board, and have a great day. Take care.